Hello and welcome to PT 668. We will be talking about getting the job today, curriculum vitae writing and interviewing skills. And I guess I should probably also include cover letter writing skills. We can throw that all in there. So you've graduated. Well, you haven't graduated yet, but you will be graduating relatively soon. And what you're going to want to do is get a job. It's time to get a job. And I imagine, and I'm going to go out on a limb here, most of you have not had a career type of job or a professional type of job. Not that your jobs haven't been serious at all, but there are some different characteristics and different procedures required when applying for and even seeking out a professional type job. So we're going to take a look at some of those key distinctions and that maybe what you've done when getting a summer job or even a short-term job that you might have had already. And so this will hopefully prepare you as you embark upon the job search. And really, it's not just a job search. This is now kind of your career search. So there's a little bit more import with everything that you'll be doing. So hopefully this will provide you with some guidelines and certainly will answer some questions that I know I had when I was a new graduate or soon to be a new graduate and just wasn't really sure about how to go about the job search process. And particularly as a new grad, understanding that you're coming out, even though you have had a very good education, you'll have had 3 clinical internships under your belt, you're still fairly new to the profession and you may be going up against more seasoned professionals for that job. So I'll give you some tips and tricks and how to, I guess, market yourself or position yourself better for getting that job. And just because you'll be new graduates isn't always a disadvantage. Yes, it certainly can be, but it isn't always a disadvantage. So, I guess the first thing is, where do I look for a job? And really, one of the best places to look for a job is on your clinical internship. So you get 3 full-time clinical internships. By the time you're watching this, you'll have had 1, and you'll have a couple more to go. And they're a great opportunity for you to assess whether that place is a good fit for you and likewise whether you're a good fit for them. Many places are hiring, but even if they're not hiring at any given time, they may have positions open up in the future. And if you had a very good experience there, you made strong connections with some of the staff at the internship, that's a great opportunity to get your foot in the door. So it really is kind of an on-the-job interview. And a survey recently, it was 81% of healthcare employers report hiring interns at some point. So not at any given time, but you never know. And if you really love one of your internships, maybe they don't have a job when you graduate, but in a year or 2, things may change. So it's also important to keep in touch with those people. I also encourage you, in addition to watching this PowerPoint presentation, and I'll give you some tips and tricks for writing resumes and practicing interview skills, what you might do on your clinical internships is speak with your clinical instructor, or if there's even a director of HR where you're doing your internship, and ask if you can have an hour of your time, talk about some of the things they're looking for when they're hiring, even if they're not hiring at the moment, and maybe they'd even be willing to help you practice with an interview or take a look at a resume. So I'll give you some advice. Everyone else has their 2 cents to put in, so I don't claim to be the 100% authority in this, although I've been involved in a lot of hiring over the years, so there's certain things that I do look for, but someone else may look for something else. So it's always good to keep asking and asking, and you may get good tidbits of information as you go along. Another place to look for a job is with a job fair. It's less common these days. It used to be that a lot of PT schools, they'd host a job fair. Some of the big employers would come. things have shifted towards virtual recruiting. So the job fairs where everyone just kind of turns up and walks around, you get little goodies and grab bags, kind of like you do if you go to a conference, and then you get to meet people, do a bit of glad handing and so on. That it just doesn't happen as much, but they still do exist. So it can't hurt to check one of those out as well. The APTA and CPTA job boards are also very useful. Not everyone advertises on these sites, but you should actually automatically, I'm saying sign up for emails, but I think if you're a member, you should automatically get those anyway. I know I'm constantly getting, probably once a week, hot jobs or whatever the term they use for the APTA. But do keep in mind that not everyone advertises. In fact, a lot of people don't advertise. There can be a lot of word of mouth, which I'm jumping ahead of myself here. There's also some recruitment websites, so Indeed, Monster, Glassdoor, LinkedIn, and believe it or not, even Craigslist. Sometimes that's kind of gone by the wayside, but it can't hurt to poke around. So you might see some jobs offered there, but check out some of these larger websites. You can also go directly to some of the large employers. Let's say you're interested in Sutter or Kaiser, you can go directly to their website and they'll usually have some job postings. So that's another way of using the internet for recruitment, or at least the job search. Conferences are another great place. Again, some of the larger employers may have little booths set up at conferences. The other thing that will happen is, and this leads into the next point, some networking. You often meet people at conferences. I've met people, you go out for dinner, have a few drinks, next thing you know, they want you to come work for them. I'm not saying that always happens, but it's a great way to just get to know people. And you'll find in this profession, many of the best jobs that you get are from networking. You know someone, it's a personal referral, it's word of mouth. And so I can't emphasize enough the value of establishing a very good professional network. And you're going to really have to cultivate that. So make a point of doing that. And you never know when it might pay off. And this is one of the things I've always found, that you never know when a job might appear. And I have stopped doing that now, but for much of my career, I would regularly, maybe once every 3-4 months, just kind of browse some of these websites and see who's hiring. And I actually did find a job that way, good thing I was just kind of casually looking, because your perfect job may be around the corner. You may even like where you are, but you never know, another opportunity may come up that you weren't aware of, or kind of diverging into a different field or a different part of the field that you never thought you would. So it never hurts to just kind of explore and look around. And again, even the word of mouth, talking to your colleagues and finding out, who's hiring here? And so that can be really valuable. All right, so some basic tips for getting the right job. As I mentioned, as I've jumped ahead of myself, I have a tendency to do that, but that's okay. You get to hear it again. So stay in continuous search mode. You never know when your dream job will appear. I think it's also good to create a profile of your ideal job and employer. So determine what else you'd like in a job. And this is actually important. Think about this even when you're on your clinical internships. And some of you may have wonderful experiences, some of you maybe not. And it's also valuable to sometimes have, I don't want to not say a bad experience, but have an experience where you say, I really wouldn't want to work there, but really consciously identify the reasons why. I mean, sometimes it could just be the people, and people come and go, so don't always use that as your metric for choosing a place to work. But certainly you can get a sense about maybe some of the practices that a place uses. So get a sense of what you like and don't like about maybe some of your clinical internships, jot some of those down, and then also think about some other things and speak with other people about what do you think is important for you. You may not be able to check all of the boxes when you ultimately do get that job or apply for that job, but hopefully you can check most of them. The other thing that's really important is to develop skills to match those of potential employers. So I have been an employer, a manager, a hiring manager. I've done all those things. And the big thing that I want to see, I don't care so much if someone has a ton of experience, although that can be valuable. Don't care how long they've had experience or how many letters they have after their name and so on. I want to know, hey, we've got this is our patient population at my clinic, and we see these types of patients. So I want to bring someone in who has those particular skills, even if someone else may have a longer resume, but their particular skills don't match specifically what we need at our clinic. So keep that in mind. So, and it may be, I know some of you might be interested in doing pediatrics, or some of you are interested in working in a hospital, for example. Those tend to be tougher jobs to get just because there are fewer pediatric clinics. There are fewer hospital jobs than there are outpatient jobs and skilled nursing jobs because there are just fewer hospitals. So you may not be able to get one of those jobs when you graduate, but you might. I've known plenty of new graduates who have, but keep in mind you may not. And it's like, okay, well, how do I position myself so I might better get that hospital job? All right, I want to get some acute care practice. Well, maybe I work in a skilled nursing facility, which is kind of subacute, so you're seeing similar types of patients, and then maybe apply to, to Sutter or Mercy or one of the big hospital groups as a per diem. So you're doing fill-in, or you're willing to do weekend coverage every now and then. Now your foot's in the door, and yeah, they may not have a position right away, or they may require that applicants have maybe a few years of experience under their belt, particularly if it's a hospital that sees high complex patients. Somewhere like UC Davis, I think they have some restrictions. I don't know exactly what they are, but I don't think they hire new grads directly there. But you get a few years under your belt and they already know you, you know them. Then when a position does come up, hey, well, we know you. We'd rather you come in, because as an employer, one of the biggest fears with hiring someone is having this unknown entity. And that's why I say you use the clinical internship as a job interview, but also, yeah, if you can do some part-time work, some per diem work, fill-in work, so on, where they just get to know you, that's also a great way to eliminate that unknown, which, as I said, is a big fear for a lot of employers. And it should also be a big fear for a lot of employees. You want to know what you're getting yourself into. Also know your worth, and I'm not talking about the dollar value, although we will talk about that when we talk about some negotiation. But your worth as a clinician, and be realistic. Okay, what skills do you have? What are you missing? And then you really need to identify an agenda, and this is part of why I have you do the professional development project. So you've set yourself a continuing education agenda. So you've identified, what are my clinical interests, and what are the gaps, or what are the skills needed for that, and what are the gaps in my skills? Because even though you've been given a well-rounded education in school, you do come out with a lot of gaps. And even seasoned clinicians have a lot of gaps. I mean, we all develop little niche specialties, and there are certain things that I wouldn't feel comfortable with, certain patient populations. It's just been too long, but other ones I feel very comfortable with. So keep that in mind. So no, may not be realistic. Hey, I want that pediatric job, but I didn't have a pediatric clinical internship. I just have one course. I haven't taken any con ed. So you do need to be realistic that, you may not be the best candidate if there are other candidates who have that experience. So then you need to identify, well, how do I gain those skills? And some of it can be con ed courses or signing up for a residency or something like that. You also want to help employers find you, and again, getting on social media, LinkedIn, job fairs, conferences, and so on. Make it known that you're available. And I'm going to say it again, network, 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 network. I can't emphasize this enough. Honestly, other than my academic jobs, which you really do have to apply for, almost all of my clinical jobs were word of mouth. Other than my first job, everything else was kind of word of mouth. I knew someone was made a recommendation, and it's really valuable. And I've even had people recruit me, come in, kind of headhunt me, if you can believe it. But a lot of that just has to do with developing a strong network. It makes such a big difference. I hate to say it, but even more than some of your skills. Yes, your skills are important, but it's a business, and in the business world, networking is so valuable. So don't underestimate that. So I'll probably say it again sometime in this presentation, so you'll get sick of me saying it. But hopefully it'll resonate with you. Oh, I think I jumped ahead. There we go. So the first thing before you've identified a job that you like, and what you want to do is send a cover letter, and the purpose of the cover letter is to introduce yourself, and this initially establishes how your education and skills meet the job requirements, and it's also to request an interview. So those are the three purposes of a cover letter and nothing more. And I will be frank with you, having read or skimmed over countless cover letters in my career, I don't read them thoroughly. What I want to know is, oh, what's this person's name? Are they a physical therapist? And you would be amazed how many non-physical therapists apply for physical therapy jobs. So that's the first thing I want to see. Have they made it known that they are a physical therapist? And let's say, I manage outpatient orthopedic clinics, and I want to know that, oh, do we have a person's coming in? Do they have good manual skills or exercise basics? So I want to see how their skills match up. If I have someone who's only worked in a skilled nursing facility and they want to come work at my clinic, and I'm talking in the past here, but my clinic, we had a strong manual focus, that may not be the best person. They may be very good working in the SNF, but they may not be as suitable for the environment where I'm hiring. So you want to make sure you clearly establish in 1 to 2 sentences how your education and your skills meet the job requirements, and then you request an interview. And that should be it. So the cover letter, not a purpose of the cover letter, is to share your personal story. As I said, the cover letter is just a quick intro. Do I want to turn the page and now look at your resume? If you start sharing too much, I'll be honest with you, I might get weirded out. And I'm not just saying me. I'd say most employers, it never is beneficial to share too much. I've had people talk about how many kids they had. They're 3 cats, Harry, Ron, and Hermione, their, their whatever interests they are, talk about their political beliefs or religious beliefs. I mean, you would be surprised, or maybe you wouldn't be surprised, but people share far too much in their personal story. I don't care. I want to know that you're going to be a good fit for our organization. And so as I said, don't go into too much detail. The cover letter is not about asking questions. You'll have that opportunity when you get an interview, and it's certainly not about discussing salary or benefits. Really, it's introducing yourself, establishing how you meet the requirements, requesting an interview. And we're going to take a look at some of the details. And I've also included some links to sample cover letters as well, and you can find plenty online. All right, so the first thing is keep it brief. They only get a quick glance. I'm going to say it again. They only get a quick glance. I'm not reading through it thoroughly. I just want to know, oh, is this person, they're a PT? Oh, yeah, well, they've got skills. Great. I'm going to turn the page, and now I'm going to look at their CV. Use a business letter format. If you're not sure, there's plenty of templates, but basic, there's no indentations. The paragraphs are separated by a space. Use a formal salutation and valediction, even if you know the person. Keep this formal. No one's going to hold it against you. So it's dear Dr., Ms., Mr., hiring manager, whatever it might be. And then you close with a sincerely. So keep it as formal. No heys or yos or what up or anything like that. Even if you know them and it may be tempting, this becomes part of your employee record. So keep it as formal as possible. The first paragraph is stating your qualifications. You don't have to state your name. Your name is going to be on the header up top. It's going to be below. So you don't have to say, hi, I'm Scott Thompson. Yeah, I saw that because it's on the header and it's in your signature. So it's a bit redundant. You basically say, I'm a physical therapist with X number of years of experience and or maybe, a recent graduate of Sacramento State, or however you want to put that. Just a brief statement of who you are, not your name, but who you are, including what your qualifications are. And as I said, it's important to emphasize that you are indeed a physical therapist. And you could say, and maybe down the road, your cover letter will change. I'm a physical therapist with several years of acute care experience, or I'm a physical therapist who's highly skilled in manual therapy, or what have you. So you can kind of emphasize those specific skills, and you're going to tailor that to the specific job you're applying for. So you want to say, oh, here's a place that requires manual skills. Well, I'm going to put that in the very first sentence of the cover letter, so it's going to grab their attention. They're going to say, all right, I'm going to read on. This person, they're at least they're at least in the game. And acknowledge that you're applying for a specific position. I'm looking, I saw your advertisement for, physical therapist 1 or whatever. The hospitals use those tiered systems or whatever, but whatever it might be, kind of reiterate what was advertised so that a hiring manager knows what you're applying for. Keep in mind, if it's a small mom and pop clinic, they know what the position is. But sometimes you're sending the cover letter in, if it's a larger organization, you're sending it into an HR office. And it may not be a physical therapist who's initially reading that. It may not be someone who is aware of even all the positions because they're dealing with 100 open positions. I mean, I'm talking about a big organization. So make sure you specifically identify the position. And sometimes the positions will actually have, in their advertisement, there'll be a position or hiring number, or there'll be some identifying code. Include that. There's nothing wrong with doing that. You can put that in parentheses or whatever, particularly if it is a larger organization. And likely the first person reading it may not be a physical therapist in the department, but in fact someone in the HR department. So that will help clue them into, oh, here's the position, and then they can start cross-referencing to make sure that you do meet the qualifications. And so that's your first paragraph. The second paragraph, you're just going to state how your skills and experience align with the job requirements. So again, 1 to 2 sentences of your skills. And again, I'll give the example, I have a skilled in manual therapy. I have, 10 years of experience, so we're looking way down the road or whatever it might be. Obviously for you, it's going to be a little bit less experience, but you can even talk about how, I had a clinical internship at such and such a clinic, which gave me this experience, and you may have even started to take some Con Ed courses, something like that. If you have some very specific skills and that are very relevant to the job, 3 to 4, I wouldn't go into any more than that. You can list them as maybe bullet points. That's quite nice. So if they're, again, it could be some, as you develop in your career, it can be some of the Con Ed courses you've done, or even just describing some of the patients you've treated, but just keep them very brief so someone can quickly look, oh, manual therapy skills, oh, they're good with exercise, they know kinesiotaping, whatever it might be. So those sorts of things. The third paragraph, you could include additional or important or relevant information. Some examples, might be, it's possible that maybe someone who works there. Oh, I was referred by so-and-so, or maybe you could do a bit of name dropping. Don't rely on that too much. Or there could just be some interest. Oh, I understand, you work, let's say my first job, we worked with the Oregon Ballet. So maybe you have some experience working with dancers. So I could say, oh yeah, I have experience working with ballet and other dancers and rehab with that. That might be something kind of interesting because it's related to that particular practice. But don't add fluff. And we'll talk about some of the examples of fluff that you should just leave out. Acknowledge that you've enclosed your curriculum vitae, and then ask for an interview, and of course provide your contact information. So it's probably best if you want them to contact you via email, just list the email there. If you want them by the phone, but you will have at the top of the letter, in the letterhead, you'll actually have your name, address, all your contact information. But if you want them to give you a call, put your phone number in right there, and you can even say, email is best, or phone, or text, or TikTok video. No, you don't do it that way, but however you want, you can include that there. And then the last paragraph is basically, thank you for your time and consideration. It's as simple as that. It doesn't have to be anything more than that. And then the valediction, sincerely, with your name. And then I would also put your credentials down. So you will be, when you graduate, now you may be applying even before you graduate, and you could even start some of the application process maybe in your last clinical rotation. So you would put down SPT, and then it would be important to indicate in the cover letter that you are soon to graduate, but maybe you haven't got your license yet, but you have graduated, then you would have the PTLA, or physical therapist license applicant, which we've already learned about that. But also if you're a PT, then you would just indicate that, or you could put DPT because those are your credentials. All right, the CV, or curriculum vitae, or your life's curriculum. Sometimes the resume, they are slightly different. I'm not going to get into the semantics, but we like to call it curriculum vitae. It makes us sound smarter anytime you use Latin. All right, so the purpose of the CV is to get the interview and ultimately get the job. So you've maybe piqued their interest with the cover letter. They at least haven't crumpled it up and thrown it in the bin or so. This person's weird. So as I said, because you haven't shared too much of your personal information, they don't need to know your astrological sign or anything like that, or any weird birthmarks or scars you have. Please don't tell them any of that. So you've done a good job with your cover letter, and now you're going to wow them with the CV, or at least pique their attention or pique their interest so that they might invite you for an interview. And this is your first opportunity to share your education, your skills, your experience, and so on. And you can embellish upon those during the interview. So it doesn't have to be overly verbose. You want, again, simple bullet points. I don't like reading resumes that are in narrative style. In some professions, I guess that's the trend these days, and there are all these different types of resumes you can do, but I think for the healthcare field, a basic chronological resume or CV is fine, and we'll take a look at what that looks like. But be brief. You want to include important information, but be brief. And as I said, we'll look at some what that really means. So some general principles: use a simple format. Don't worry too much about the length. You've probably been online. Oh, keep your CV less than 1 page. Well, that's for kind of the new graduate applying for the basic position at Best Buy or something. When you are a professional, your CV is going to get long. I mean, mine is, I don't know, 7 or 8 pages long, and I leave a lot of stuff out. I do know in academia, some academics like to list all of their published work, which I think is actually generally, no one wants to see that. They'll often say just, for the last few years, the last 5 years, or select published work. Now, granted, we're not talking about an academic position, but some academics have these ridiculously long resumes. But it's pretty normal. Once you start getting some years and some jobs and some experience and some skills under your belt, you will actually have a longer resume. So don't worry about the length. I'd rather have it a few pages where it's typed big enough that I can see it. It's well formatted. It's just easy to follow. All right. So this follows up. Do make it easy to read. So legible size type. Many old people like me are reading your resume, so don't put it in like 9 or 10 point type. Use 12 point. It's fine. If it means it goes over a little bit, that's fine. And if you need to space it out a little bit so you don't have like one line on the next page, fine. But make it easy to read. Make sure there's good enough space between it. If you're sending a digital CV, which actually is the norm nowadays, people rarely give a paper CV, but use sans serif font. What is sans serif? So the serifs are all those little kind of curls and things at the end of letters, like Times New Roman, I think, is a serif font. So things like an Arial or a Calibri don't have the serifs. I took a web design course years ago, and they always mentioned using that because it is actually a little bit easier to read for digital. So I haven't looked into that too much. So this is information I'm sharing with you from my web design instructor, oh goodness, 15 or more years ago, and I still remember that. So all right, so I'm sticking with that. I'm sharing that information. Use uncrowded, evenly spaced formatting, and be consistent throughout. So your headings should all have the same type size and then the same font. The spacing should be the same, so make sure everything's consistent. When I see inconsistencies, it kind of makes me think this person isn't very organized. I mean, if they have a good resume, that's fine, but you want to make it, you don't want them to be noticing odd things about your resume. That shouldn't be the thing that attracts their attention, like the font size or the format. What should be attracting their attention are your great skills that you're sharing with them. So keep that in mind. And as I say, choose a clear format and stick with it. And I do think the chronological is most common in healthcare. And so we often talk about going from the most recent to the farthest into the past. People want to know, what have you done recently? And then they can look further and further down the resume to see what you did in the past. You can also create a skills-based CV. I'm not going to get into that here. You can go online and look at some examples of that, but they don't highlight less of where you've worked, but all of your specific skills. And that actually may be useful if once you've got some years under your belt, and maybe you end up like my best friend from PT school, he's been in the same job for 25 years. Yes, I've been out for 25 years. He's been in the same job, and so he's only had one employer. So for him, he isn't going to have a list of all these different employers. I think he's the only one from our class who's done that. But he could actually emphasize all of his skills because he's worked in that same place. You want to use action words to describe your accomplishments. What did you specifically do? I implemented this, or I strategized this, or I did, I achieved this. All of these things that describe achievements. How many patients did you see? Did you increase revenue? I mean, things like that. Employers like that. They want to know. They want to know that you have skills. But if you started some project that brought in extra money to the clinic, great. As an employer, I love that. It shows, one, that you're bringing in extra money to the clinic, which is always a big issue, but dollars and cents are a problem. But it also shows that you've got some real impetus to be able to take charge of things and take the initiative. So that's really, really important. You want to highlight your relevant skills. And again, think about what the job is. So you're tailoring that CV to the job. Where am I applying? What skills are particularly important? Yeah, you can talk about some of your other skills, but if you're working in an acute care setting, you're applying for a job in an acute care setting, you want to highlight skills relevant to that. Even if you have, maybe you learn all about kinesiotaping and you're great with that, or instrument assisted massage, that's great. That's not going to help when you're treating someone in an ICU. And if that's where you're applying. So maybe include that, but certainly that shouldn't be the top of the list and it shouldn't be emphasized. So you want to really emphasize the skills that are relevant to the specific job. I can't say that strongly enough. That grabs the employer's attention, because if you just list this, you kind of have all these skills just thrown onto the page and they're looking through, well, this is all great, but how does this fit in with what we're doing? So the most important skills relevant to that job you want to put first, and you want to really emphasize how you are going to meet the employer's needs. That's what gets you hired, you meeting the employer's needs. So always keep that in mind when you're interviewing and when you're writing this CV. All right, some don'ts. Do not use fluffy jargon. What is that? So these are terms that don't mean anything and only demonstrate your knowledge of cliches. I'm detail-oriented. Well, that doesn't mean anything, and if you have one mistake on your resume or your cover letter, they're going to realize that's not the case. And it doesn't mean anything. You can say that. I'm a team player. All right. How are you a team player? Again, it's fluff. I'm a hard worker. I'm an ass kisser. Actually, that one works. If someone comes in, I will hire them. You don't want to use the passive language. What things happened to you? What were your job duties? No, you want to talk about the things that you implemented, the initiatives you took, the accomplishments you achieved. What benchmarks did you set? All those sorts of things. So it's very important that you're sharing as much of that as possible. And even, again, you're not going to have a ton to draw from as a new graduate, but you can certainly talk about how many patients you saw in a busy setting and the complexity of those patients, and describe how you used all of these various treatment techniques. I used NDT, or I used kinesiotaping, maybe not on the same patient, but you get the idea. And even if you gave an in-service, describe that, or talk about, if you did presentations, there's opportunities for that later in the CV, but did you give a presentation at a conference? Talk about everything you did in terms of an accomplishment and how you got your patients better and how you made the place where you worked or did an internship better. You do not want to include irrelevant information. As I said, it should only match the job position. And this also includes in terms of listing your jobs. Oh, what jobs should I list? Well, it's fine to list some of your aid jobs, but I don't know, that's probably not going to get you the job, because everyone who's applying has been an aide because they had to do that to get into PT school. So it's fine, I guess, if you're feeling that you're CV is a little bit sparse. There's not a lot of meat to it. You want to add a little bit more. Certainly include your internships and describe in detail the patient populations you saw, the type of treatment techniques you use, anything that shows that I have these skills even beyond what we learned in school. And I'm sure you're going to learn a lot of stuff in the clinic that you didn't learn in the classroom or the lab. You also don't need to include your job as a greeter at Chuck E. Cheese, even though maybe you had that job for 8 years and you were really good. You got Employee of the Month 3 times and you got your own parking space and all that stuff. That's great. It's not relevant to a physical therapy position. So I don't care about any of the old jobs you had. I don't really care even about your high school education. I actually don't even really care about your undergrad, although it's fine to include your undergrad. But you certainly we don't need high school information. So only things that are really relevant. The only time I might list a non-PT or healthcare related job on a CV would be if you had a management position, or maybe you were even an owner of a company at some point, and that shows that you exhibit responsibility, that maybe you took some initiatives, that you're organized, and so on. So that might be the only time. But again, yeah, the greeter at Chuck E. Cheese, I don't know if there is a greeter position. I've been banned from Chuck E. Cheese, so I don't know how it works anymore. All right, and you don't want to lie on your resume. You may be found out. And you also don't want to use colorful or ornate paper background. You don't want flowers or kittens or something all in their things that say love in the background or things like that. Even though you might be a very loving person, and that's great, but they don't need to know that yet. They don't need to know that you're actually insane just yet. You can reveal that later once they've hired you. All right. So the general structure, you're going to have your name and your contact information. You want to include a professional email address. Now, some of you might use your Sac State email, but you may have another email. But make sure it's professional. I had to change my Scotty to hottie@hotmail.com because it just wasn't professional enough. So you want to make sure you have something that's a little bit professional. You want to include your professional licensure. If once you get your licensure, you include that right on the top under your name and address. So they know, oh, this person is a PT and they are actually licensed. And then they can go online and check your license. And you can do that on the Physical Therapy Board of California website. You want an introductory statement, just a brief 1 to 2 sentence statement that highlights who you are and why your skills align well with the job. In a way, it's a reiteration of what you've done in the cover letter. It's very brief. This is who I am. This is the job I'm applying for. These are my skills. This is how I fit in, but really in a couple sentences. We don't want to have to read a whole bunch. I want to be able to look down quickly because as a hiring manager, you're seeing lots of resumes. I want the stuff to pop out at me. I don't want to have to work for it. You can then have a summary of relevant skills, which I think is nice to have at the top. 6, 8, 10 skills, whatever it might be. Have them bulleted. Again, skilled in manual therapy. Maybe you got your, level 3 of the North American Institute of Manual Therapy, something like that, or you did some kinesiotaping workshop, or you're certified in lymphedema, or whatever it might be that you've done. Highlight those skills and including some experiences that you have, and that could even be working with complex patient problems, or working with children with congenital disabilities, things like that. So of course, then that would be appropriate if you're applying for a pediatric job. So highlight the relevant skills. Again, relevant is the key term, particular to the job you're applying for. Now, some people like to put their work experience first. Some people like the education. I've always done education. You're not right or wrong. No one's going to say, well, they put the work experience before the education. We really like them, but we can't let that pass. We're not going to bring them in for an interview. No, it doesn't matter that much. But so you do whatever you feel comfortable with. I put the education first. And of course, you're going to put your most recent first, and then just down to the undergraduate degree. Don't put your GPA down. No one cares. It's actually considered kind of tacky. When I've seen it, I kind of make a funny face. You can't see me doing that, but I'm making a funny face as I'm reading this right now. So it's just, no one cares. GPA means nothing. You've all got through the program. You're all licensed. What I want to know is your skills and abilities to work with patients and to be an attribute to the facility. If you're lording over us with your perfect GPA. Oh, yeah, all right, great, good for you. Really, I mean, no one cares. And so, and it's great if you do have a perfect GPA. Congratulations. Yes, you should be pat yourself on the back, but employers don't care and colleagues don't care, and you'll find that. All right, you want to include your relevant work experience, including your clinical internship experience, as I said, in the most recent first. And again, it's okay to include non-healthcare work experience if manager. So I do jump ahead often, but it's good to hear this again. You can also then include professional membership. So actually, let me go back to this. With the work experience, of course, don't just list what it is that you did, but you're where you worked, but you're also going to include, as I said, some of those action terms to describe the experience as well. And I find that's good to use bullet points for that. Include any professional memberships, your APTA, and any sections you belong to, any continuing education courses you've taken, or even if you're planning to take. And as a new graduate, you may not have taken any, but if you may have signed up for some, include that. And then say, oh, wow, this person's going to be taking this course. That's a good course. Great. They'll come in. They'll at least have a little bit more knowledge if we decide to hire them. If you've done any publications or presentations, you can include that as well. If you have any honors or awards, and certainly volunteer work as well. And then at the very bottom, you'll put references available upon request. You do not actually include the references, but you will have those available. And usually that happens once you're asked for an interview. And then what you can do is we'll talk about the interview process. You can actually bring in a hard copy with that, but you can also share that with the hiring manager via email as well. Just ask them what their preference is, but you don't provide that on the CV. You just say that it will be available as needed. And its standard is to have 3 references. So I want to caution you. Ask your references, your referees, ahead of time. I have had a number of times where I've been called and said, oh, someone used you as a reference. I'm always, I'll give them, I'm not going to give someone a bad reference. And I have a couple friends and colleagues, and I have a friend who does some traveling, and he's oftentimes needs references because he moves around. We have kind of a standing agreement that he can always use me. He doesn't need to ask. But for the most part, do ask and say, hey, is it okay if I use you as a reference? And you can certainly use faculty. My recommendation, though, really is to use your clinical instructors because they've seen you in the work environment treating patients. They actually have a much better sense of your clinical skills than any of the faculty do. That being said, sometimes you get a clinical and maybe you bumped heads with that clinical instructor. You just didn't get along, and that's fine. That happens. And maybe you feel, oh, I don't want to use that person. But sometimes you can also use someone who wasn't a clinical instructor. On my last clinical internship, I became quite friendly with one of the other PTs there, and I asked her if I could use her as a reference. She wasn't my CI, but she said great. But she'd seen me work, and we had interacted a lot, so that actually works out pretty well too. So this is again about expanding your network. All right, and so I have put some examples in I need to check this session may be different. I need to double check that. I will make it out. It may not be the session 8 folder. I keep changing things around from when I write this, and I probably should have checked that before I did this. So whatever the getting the job session is, so disregard it might be number 8, but I think it actually isn't. But it is in the folder for all of the getting the job. So you can take a look at some examples there. Sorry for the mistake. All right. Okay, so let's say that you've wowed them with your cover letter by actually not showing too much about yourself personally. You have done a very good job at describing your skills with action verbs, not using passive verbs, and highlighting your relevant skills and showing how well educated you are. And they've invited you for an interview. So of course you don't want to go in cold. You want to be as prepared as possible. So the first thing to do is know the organization. Now you don't have to know everything about their history and all the people who work there. I've never really gotten into that too much, although sometimes it's nice if you can learn a little bit about the interviewer, particularly if it's a smaller organization. You may find out about the owner, and a lot of them will have a web page up. You can go through and browse a little bit and see, oh, and especially if you have a shared interest, a personal interest, that can always help. My first job, the owner of the clinic and I both windsurfed, so that was an icebreaker. All right, but that may not be the case. But really what you need to know is identifying the needs of the organization. So seeing, oh, what type of patients do they treat? What's their patient load? Do a little bit of sleuth work, see if you can find out as much. Even finding out about their insurance, you can just do a fake call and pretend to be a patient or a doctor or something. Try to find out as much as you can. And this is, again, where you are ready to describe your skills and how they will meet the needs of the facility where you wish to work. Know what message you wish to project and prepare to highlight your attributes. So think about, I know it's been a while, I hate to bring it up, but think about like presidential debates, and you see how no matter what questions are asked by the moderator, have you ever noticed the candidates, they have a message they're going to get across one way or the other. They're going to dance around the question, and then they're going to take a right turn or a left turn and really just talk about the message they want to project and highlight their attributes. And really, you should be doing that with the interview as well. So you want to make sure you have the opportunity to have a list of all the things that you're great at and what you're going to bring to the table, because you don't know what they're going to ask you. And you don't want to have the interview end and say, wow, I had all these things I wanted to tell them. So it's fine to answer a question, but you need to be able to sneak in some of that other important stuff as well. So be preemptive with that and describe, what do you want them to know about you? The other thing is, when they ask questions, it's more common now to get behavior-based interview questions. I will say not always, and it really depends on where you interview. The small mom and pop clinic, you're going to have someone who's a clinician, a clinic owner. They may have a small staff. They may not have a lot of experience interviewing people. They may not be very good at it, and that's the reality. Being a good interviewer is a skill, and when I first became a clinic manager, I wasn't very good at it, and over the years, and I got some training and really learned how to do interviews much better and really extract the important information. So keep in mind, some places you might get the sense that this person really doesn't know what they're doing in the interview, and that they may be just as nervous as you. But you will find, particularly some of the larger organizations, particularly if they have an HR department, they may have started to do some training on that. And there's a trend now, it's shifting toward these behavior-based interviews. And the questions will typically start with, tell me about a time. And it won't be the questions like, what would you do in this situation? They'll want to know, well, did you encounter this situation? And, and how did you respond? And I'll give an example. Tell me about a time where you experienced conflict with another colleague. What did you do? All right. That's a pretty vague question, so it gives you the option to pick any number of answers and go with it. Or, tell me about a time where you worked with a patient where you felt the complexity of that patient was over your skill level. How did you respond to that? Tell me about a time where you took the initiative at work, and what did you do? Or did you tell me about a time that you increased revenue for the clinic where you work? Something like that. There could be any number of tell me about a time. So there's a link at the end of this presentation to the big interview, which is by Sac State. It's not specific to PT, but they have a lot of these general type questions. And I would encourage you to go through and read as many of those and try to come up with answers, because you are going to be asked some tough questions. And the worst thing is to not be able to answer a question. So you want to make sure that you are prepared for some of these tell me about a time questions, and think about all the possibilities. And a good way to do is also prepare some of your own questions. Think about, well, what if I was hiring? What would I want to ask someone? And that's a great way. So come up with a list of 20, 30 questions and make them tough, and then practice answering them. And then, of course, you also want to practice with someone. How often do you do job interviews? Hopefully not that often. It means you're not searching for jobs. You're holding down a job. So you may be out of practice as well. And be honest with yourself. Some people can just speak without thinking. Others, and you probably know this about yourself. Oh, I really struggle with this. I get nervous. My sister, who is, she's kind of an executive position in an internet company, internet provider company. But she always says, she actually says, I've lost some jobs over the years because I'd make it up to the last two or three, and then she interviews terribly. So she's aware of that about herself. And it's good to be reflective that way. So she's tried to work on her interviewing skills. And so if that's you, then you really need to practice. You can record yourself and see how do you look, all those sorts of things. Do you I don't know, are you fidgeting? Are you staring uncomfortably at the person? Do you have a nervous laugh? All of those sorts of things. So being aware of that and trying to work on that. And then also just practicing, having a friend throw you some tough questions, from left field, and how do you respond in the moment to that? And as I mentioned before, so not everyone's good at interviewing either. You do want to dress professionally. And this was always a question for me when I first started applying for jobs, or how do I dress? Because everyone in PT dresses kind of casually. In the hospital, they're wearing scrubs usually, and even in the private clinics, it's the khakis and the polos is the uniform of choice, I guess. And some people might dress up a little bit more. But when you're going for a professional interview, if you're a man, wear a jacket and tie. If you're a woman, you can wear a business suit, either a pantsuit or a skirt suit, whatever is appropriate. But yeah, that should be something nice. Something relatively conservative. You don't want anything loud or anything that looks like you're going, one of these shiny suits that look like you're going out to the nightclub or something like that. I do encourage you to bring an extra shirt or blouse. What if you spill coffee on yourself in the way to the interview? Because this will happen. You're like, I'm nervous. I'm going to get myself a cup of coffee. And then sure enough, you have to hit the brakes and suddenly you've got coffee all over you. Now, I haven't seen that happen at an interview, but I was in a car ride with a couple of colleagues, and one of my colleagues, and a good friend, he was like a regional director of a fairly large PT organization, and we were going to this regional meeting, and he was leading it, and we stopped to get coffee, and sure enough, he spilled coffee all down his shirt. Now, granted, he wasn't going for an interview, but he had to stand up in front of all of these people who worked under him with this big brown stain on his shirt. So it was kind of embarrassing. I mean, we all laughed it off, but he was annoyed with himself for doing that. So you never know. It's always good to have an extra couple of everything just in case. And particularly sometimes maybe you're traveling for an interview, you always have some extra clothes. As I mentioned, you're likely to send in your CV via email, or sometimes some of the bigger hospitals and things, they'll have a place where you just upload the CV. And it is likely that the interviewer, and even if it's a panel, they will have copies of your CV. Bring some hard copies just in case. It can't hurt. Have a nice little attaché case or something to bring, a little binder, leather bound, something that looks nice and professional. You can have some extra things like that. You do want to arrive early, and certainly if you haven't been to the place, maybe do a drive-by ahead of time. What's the traffic going to be like? You certainly don't want to be late, so make sure you know how long it's going to take to get there, and you're having to go through the tunnels of a hospital, and sometimes it could be hard to find a room. Do a dry run ahead of time if you have the opportunity, and it just kind of eases your mind, and it gives you an idea of how much time you'll need. Better to be early and have some time to kill. And then eat a good breakfast. Eat maybe what your normal breakfast is. Don't eat too much because you may be uncomfortable. You may be too nervous, but you don't want to have a crash, mid-morning or something. And don't have too much caffeine. And I say this for myself. I have a tendency to get too excitable, so I need to make sure I don't have too much caffeine. So you want to be, you want to be calm. All right. So during the interview, be authentic, and this is a chance to reveal your personality. If you're a funny person, you want to crack a few jokes, that's fine. If you're serious, that's fine. Reveal who you are. They're going to find that out, and this is important. It's not just about finding someone who matches the skills that the clinic needs or the facility needs, and that is important. But when a department or a facility is hiring someone, they want to know it's a good fit. They want to work with someone they like. I mean, think about all the jobs you've had, and you've worked with people you've liked, and you've worked with people that you don't like. And I'll tell you, even if someone's good at their job, but you don't like them, you'd still rather work with the person you like. And that's just human nature. So being likable is really, really important. And so, you know, you all have great attributes to your personality. Let that show, let that shine. And it may be that your past personality doesn't fit with a place, and that's fine. And better to find that out during the interview. And if you leave like, well, I didn't really get good vibes from them, and maybe they didn't get good vibes from me, even if everything else about the place seems good, that it may not be the good fit for you. Because keep in mind, you're also interviewing them as well. You want to sell yourself. You have that skills and knowledge. Emphasize those and relate them to the needs of the position. Keep that in mind. What skills do I have? What have I learned in school? What have I learned in my clinical experience? And of course, down the road, your work experience, any Con Ed courses you've taken. Emphasize those skills and try to bring that up as much as possible to show that place that, yes, I have the skills to do the job here. I will be an attribute to this facility. Be concise in your answers. Less than 2 minutes a question. If you go on too long, they'll lose interest. You also want to ask questions. You know, is the job a good fit for you? Don't ask that question. Is the job a good fit for me? No, you want to find out more about the place, and you may have a few questions written down ahead of time. I think that's a good idea. And you know, having experienced interviewing, you know, many of you as students entering the program, you all came in with some questions when you interviewed with the panel. It's the same idea. And so you know, some of you had some excellent questions. So you have the ability to do that. But you also can kind of, you know, go with the flow. Sometimes the conversation goes in a certain direction, and that will help guide you with questions as well. You want to demonstrate enthusiasm. If you're interested in the job, let them know. You know, some nodding, the occasional smile. You don't want to have this permagrin on your face, you know, kind of this fixed rictus where you're just kind of grinning at them and they'll think you're a little bit weird. But you want to be positive and smile and make eye contact and things like that. And if you do want the job, you know, to explain state that you want the job. As the interview wraps up, let them know, yeah, I want this job. They may not be good at reading you. As I said, not all interviewers are good interviewers, so they may not be very good at reading you. So you want to explicitly state, yes, hey, I think this is a great fit. I'm really excited about this position. I would like this job. I hope you'll consider me. And then you can also state why you want the job and maybe give a few details why the job is good for you as well, because that's important for an employer. They want to know that, oh, this person really wants to work here. When I hire someone, I want someone who wants to work there, not just because they want a paycheck or, oh yeah, this place is close. I live only a mile away, so this is great. That's not a reason that I want to hire someone. I mean, that may be one thing that's of course nice. Hey, that's extra. That's gravy there, but it shouldn't be the reason why someone wants a job. So you want to make sure you're explaining why you really want that job. All right. So some don'ts for the interview. Don't look or act unprofessional. So tardiness, as I said, do a dry run, check out the traffic, find the place ahead of time. Sloppy dress professionally. Poor etiquette, use good manners. Look them in the eye, greet them, shake their hand, all those sorts of things. Just even in terms of how you communicate, try to avoid using slang, things like that. You don't want to be unprepared, so you do need to know what the job is. And as I said, prepare your answers and practice interviewing skills. We all could benefit from that. We don't get interviewed all that much, so as you know, you're not good at something unless you practice it. So practice your interview skills, and you'll find you'll get much better. You'll stay on track more. You'll have, you know, less ums and ahs, and we all do that. I do that a lot. But you know, with better practice, you can eliminate some of those. So that can be a real advantage to practicing the interview skills. And plus, you'll also just get really good right off the top of your head. They ask you some of those tough questions. You'll be, oh yeah, I practice this. I know the answer I'm going to give them. You don't want to provide poor content. So you want to avoid cliches like the plague. You want to avoid red flag answers. So things like, oh, why do you want this job? Well, yeah, I just live down the road. Yeah, that's a red flag for me. Or yeah, I didn't like the last place that I worked. And actually, that's kind of being the negative, talking about trash talking a former employer, but that's also a red flag answer. And don't fail to answer a question. And you may get some questions that are tough. And if you're really struggling, hey, can you repeat that again? Or can you word that a different way? It might buy you a little bit of time, because we sometimes hear a question. It's like, oh, I didn't really think about that. And you may need a little bit of time to formulate a cogent answer. And as I mentioned, don't be negative. Don't trash talk current or former employers. It's bad form. That's poor etiquette. We're also a small community. You be surprised how many of us know one another, and it's just not good. And you may have all of the reason in the world for trash talking. And maybe it was a truly horrible, abusive place. Maybe they broke the law. Maybe they did all sorts of things. That doesn't need to come up at your interview. You may be down the road when you become friendly with them, they ask you about your job. Yeah, maybe you want to share some stories, but even then, be cautious about that. Wait till you really know people well and know who knows whom before you start talking smack about other people. You also don't want to be overly solicitous. Oh, Dr. Thompson, yours is the best clinic. I've talked to so many, don't. I just want to hear about you. I don't need to be flattered. And I've had people come in and they're just excessively flattering me. And it's like, all right, okay, that doesn't... I kind of joked before about the kiss ass. I actually don't want a kiss ass. I want someone who can do the job. I don't like that over solicitousness. And you don't want to bring up pay or benefits. The interviewer must make that overture. And this is a key point. And actually, once they bring up pay and benefits, it means they're interested in hiring you. That's key. I don't bring up pay with an interviewee, unless I'm actually intending to hire them. Why would I? So if they bring up money, you know they're ready to make an offer. So keep that in mind, but you don't bring it up. It's bad form. All right, just a slide, dress for success. You can see the do's and the don'ts. We can see the professional attire for both the ladies and the gentlemen on the left. And although nice attire, unprofessional, when in doubt, overdress a little bit. I do actually think the guy's suit on the left is a little bit too shiny. He looks like he's going out to a nightclub, but that's fine. You do want to be a little bit more professional. I'm never going to say, oh my goodness, can you believe that person wore a suit? And even though we do dress casually in the profession, the interview's a time. You look your best. Someone comes in with a nice looking, well-fitting suit, and that's really important. Don't wear your same suit that you had in high school, or guys and gals, or ladies and gentlemen, make sure it fits well. And that's maybe worth a little bit of an expenditure to have a really nice fitting suit, because it makes a difference in your appearance. And it's all those little things. And I know it seems a bit superficial, but it can help. I've had people come in underdressed for interviews, and it kind of like, oh, really? That's what they wore? And so, I mean, I don't know, it sometimes leaves a bad impression. All right, I need to talk about, as I said, the big interview on the Sac State website, and I have a link later. It gives you some examples, but here's also some examples for some questions. Tell me about yourself. Be prepared to tell about yourself. Again, don't get into too much detail about your personal life. Talk about yourself more in terms of your profession. It's fine to share some interest, but you don't need to get too much into the details. I've had people talk about they're going through a divorce and things like that. It's like, yeah, I don't really need to know that. I want to know that you're going to be a good employee, and you might be, regardless of whether you're divorced or not. Be prepared to answer, why do you want the job? It's such a straightforward question, and actually a lot of people get stumped on that. So really make sure you know, why do you want the job? What makes you the best candidate? Well, that's tough because you don't know who the other candidates are, but this is where you just go and highlight your skills. And again, these are my skills, and this is how they align with the job requirements. And make sure you read the job posting thoroughly. Make sure you read the essential job requirements very carefully, so you know that everything is expected of you, and then you can go point by point and describe how your skills, how your experience, how your knowledge matches that job description. If you can do that, yeah, I mean, you can't do any more than that. Then it just comes down to really, do they like you, I guess. And as I said, you'll be asked some tell me about a time questions. You're tasked with a difficult project. How did you see it through? You experienced a conflict at work. How did you achieve resolution? You identified a limitation in your skills or abilities. How did you rectify the situation? You failed at something at work. What was your response? And this is really important because we all go through failures, and it tells me people's failures and how they respond to that tell me a lot more about who they are than their successes. And I think even as students, you've all had moments where maybe you didn't live up to your own expectations, things didn't go well. And how do you respond to that? And and I've seen it. I've seen students struggle, and I've seen just the remarkable resolve and just, okay, this didn't work out how I planned. I thought I would do better, and they come around, they pick themselves up, dust themselves off, and they respond, and they succeed. So that's really important to describe that. Now, the last question is a lame question, and I don't know if people ask that too much. I've never asked this. What are your weaknesses? It doesn't tell me anything, but keep in mind, you're going to get some interviewers who aren't good at interviewing, and they may just have a random list of questions. So what are your weaknesses? So I always say fast cars and champagne, and then we have a laugh, and then they offer me the job. No, you could say that. But if you're asked that, what you want to share with them, and you do have to answer the question, there's one thing that both you and the potential employer, the interviewer, knows that is a weakness of yours as a new graduate, and that is your lack of experience. You just don't have all of the years under your belt. So don't bring up anything they don't know. And you're going to say, well, my weakness is, I'm a new graduate. But, and then you have big capital letters, but. I am signed up for these 3 continuing education courses for the coming year because I've established goals for myself. I want to learn how to do A, B, and C, and X, Y, and Z. And you're going to list whatever skills that you want. And of course, those are going to be skills relevant to the job you're applying for. And I'm signed up for that, or I'm doing this residency program, or whatever it is. So you've shared with them a weakness, and it's not a surprise. Oh yeah, you're right. Yeah, you don't have a ton of experience. You just graduated. You just passed your licensing exam. You haven't worked in the field other than your clinical internships. But I now have an agenda. And guess what? You already have that professional development project that you're working on, which is going to evolve over your career. This is just a start, but you've said, oh, I've established some goals for myself, and this is how I'm going to meet those goals to bring up my knowledge and experience. And that's the perfect way to answer that question because, again, it highlights something that they already know. They're not going to, well, yeah, I have a loose temper. You're not sharing anything like, that's going to make them raise their eyebrows. You're not going to share anything like that. No, you're going to share something that they know, but you've already shown that you've thought about it and you have a plan. And as an employer, that just looks really good for me. Yeah, you can't change that you don't have 10 years of work experience. You can't change that. But you can highlight what you're going to do about it. So that's how you answer the what are your weaknesses question if you get it. Or if all else fails, fast cars and champagne. All right. And then when you're done with the interview, send them a thank you note within 24 hours. It's common courtesy. It demonstrates professionalism. It's an opportunity to resell yourself. And perhaps you didn't get to answer all of the questions during the interview. Sometimes that happens. So you can fill in any gaps and reinforce your fit for the job. Email is okay, although I actually do think, a handwritten note is nice, but an email is sufficient in this day and age. And of course, include a specific subject line so they know what it's about and make it as a brand new email thread. But that's really important to send the thank you note and to reaffirm that you are still interested in this job. All right, so let's say all of that's worked out. You haven't scared them off, but in fact you have impressed them. You dressed nicely, you answered the questions, you said that you like fast cars and champagne. They got a laugh out of that, and they've offered you the job. So now comes the negotiation, and this is where you say, show me the money. And yeah, that is certainly part of it. And you want to know how much to ask, but as we'll talk about later, it's not all about the money. But you do need to do your research. And do keep in mind, The salaries and pay is going to be different depending on the type of facility you're working in, depending on the geographic region, and even depending on the type of employee you are. Are you a salaried employee? Are you hourly? Are you per diem? Are you contract? If you're a contract or per diem, they're not going to pay you benefits. They don't have to pay the Social Security on that. So you typically can command maybe a higher dollar rate because they're saving 30% typically. It's around a third of all the what an employer pays in terms the salary plus the benefits. The benefits are a third of that total cost. So they're going to be saving that. So you can typically command a little bit more. But you want to think about all those different things. If you're in a resort area, everyone wants to live there. Typically, employers can get away with paying less because everyone wants to live there. So that's kind of one of the drawbacks. You live in San Francisco or the Bay Area, it's going to pay more, but it's also a lot more expensive to live there. You want to live in a really rural area, depending where you are, particularly if it's like a hospital or a skilled nursing facility where they're struggling to recruit healthcare staff, which is a big issue. You may be able to command a higher salary. So you're going to have to do a little bit of research. I can't tell you that this is the dollar amount you should ask for. So you need to look, where do I want to work? What type of facility and what type of employee am I going to be? And typically the SNFs pay a little more than private practices, which pay a little more than hospitals, which pay a little more than schools. Generally. Granted, geography plays a role as well, and even certain budgets, and whether it's a private or a public hospital or something like that. You tend to get better benefits in the hospitals and schools, a lot more vacation time. That may be important for you. So you may get a little bit less money, but you may get other benefits that are valuable. As I mentioned, my friend from PT school been the same job since we graduated. And he's like, I can't leave now. I got 8 weeks of vacation a year. And that makes sense. It's like, why would you give up 2 months of vacation a year? And I think he likes the job anyway. But still, it's even if a couple times he's thought about leaving, but he's like, and he looks, you have to start back at 2 weeks of vacation? No way. So you often get benefits and maybe not as much money, but it's a balance. You have to decide what's important for you. And as I mentioned, the negotiation isn't all about the dollars. What are the health benefits? And we talked about, employers have to offer an HMO plan, but they may also offer other ones. So they only have HMOs. Maybe you don't like that. Are they offering dental? Are they offering vision? How much is the employer paying? How much is going to come out of your pocket to pay the premium? Because keep in mind, the employers don't pay all of your health insurance premiums. So that's important. And that may not be negotiable, but at least it's good to know what's available. But also, is it a big organization? They've got 10 plans to choose from, or is it a small one where they only give you, this is what we've got, mom and pop clinic, this is our health insurance. So that's important to find that out. Are there retirement options? A lot of organizations will have a 401k. Do they just have the 401k that you can invest in, or do they dollar match? How long before you're vested, meaning how long before, even if you leave, you still hold on to that money? So those are important considerations. Is there life? Is there disability insurance? Is there long-term care insurance? So it's wonderful working for the state of California. They offer all these insurances. And usually it's a little bit of money that comes out of your paycheck, but it's a very good deal. So, some organizations have better benefits than other ones do. PTO, paid time off. We often talk about vacation time, but it usually includes sick time as well. How much do you have? Is it rollover? And I think in California it has to roll over, but not every state has that. So if you move out of state, keep that in mind. How much do you accrue over time? That's really important. With some of the big organizations, they may be less flexible because, hey, everyone starts this way, but you work for a mom and pop type of clinic where they make their own rules. They may say, hey, we can't give you more money, but we can give you an extra week of vacation. So this is where you can get into the negotiation. Is there a Con Ed benefit? How much are they going to pay for Con Ed? We got no money. You get $1,000 a year. You get $500. Does it have to be pre-approved? Can you go to conferences? So these are things. And again, they may not be able to give you more salary, but they may be able to give you more Con Ed benefit. Is there profit sharing? My first job, I was surprised. I didn't know anything. I've come to find out. Wasn't part of my negotiation because I didn't know, but hey, profit sharing at the end of the year, I got a nice little check. And because the clinic did well and they gave back some money, so that's important. Also, are there promotion opportunities? That may be important for you. Maybe you want to get into a management position. It's a large organization. And there may be options to, maybe moving to another clinic or moving up where you are. Ask them about that as well. And it may be that, if it's privately owned practice and the owner's the boss, yeah, you're probably never going to become the boss. But there may be an option that, hey, down the road, is there a chance would you consider opening up another clinic? Could I manage that? And I worked at a place where the owners did that, and they set up all these satellite clinics, and you could go and become a manager at one of those. So you don't always rule that out. Is there mentorship? And this is really important as a new grad. I was promised mentorship in my first job. It really didn't happen. I like the people I work with, but we were all just so darn busy. I never got the mentorship I really needed. And so that's really important. And don't just say, oh, am I mentored? Yeah, you're mentored. Well, ask them to describe it in a little bit more detail. That's really important. Do I get a parking spot? Actually, my first job, I got a parking spot. I didn't have to ask for that. That just came with it. And I had my name there. It's kind of silly, but it was kind of nice. Oh, I get to pull in. I've never had that since. But these are other little things. But when you're asking, and I'll kind of go back to the negotiation for the dollar amount or the salary or the hourly wage, and a lot of places do hourly wage. And I know for most people that's the most important thing. Find out, as I said, do your research, find out what maybe a going rate is, and ask more. Shoot for the stars. You may just reach the moon. What you should do, and I'll just give an example. Maybe see, a place is paying for new grads $45 an hour, or something like that. You come in, don't go crazy, but say, can you do $50 an hour? And the worst that's going to happen is they're going to say no. They're not going to rescind the job offer. If I've had some people come in, I offer them the job. I want them to work for me. And I now know all of the niceties that we've had. We get along. We had a good laugh. Maybe at the interview, we seem to enjoy each other's company. There'll be a good fit. But now when it comes to the negotiation, we are on other sides of the table. And I'll give you my experience as being a hiring manager. I recognize that. This is the time when I'm going to try to pay you the lowest that I can. And I recognize you're going to try to get the most out of me. I don't take it personally. That's just the way it is. And so if you ask for a dollar amount, and maybe more than I want to pay, but if I think I might lose this person and I really want to hire them, I might see what I can do. I also might say, no, I can't do that. And I might not be able to do that. And so it's really important. The other thing, and I've seen people do this, they'll say, how much do you want? And they'll give it, I take $45 to $50 an hour. Okay, 45 then. Don't give them a range. I mean, if you say 45 to 50, they're going to give you 45. They're not going to offer you more. They're not going to do you any favors, and it's nothing personal. Take it from me. I've hired a lot of people. I've been in charge of budgets. I'm not doing the employees any favor. I want them to be paid fair, and I want them to feel that they're actually getting a good salary because I want them to stay. But if I can pay them less and they're still going to be happy, I'm going to do that. That's just good business. Just as I expect the employee or the applicant to really try to get as much out of me as the hiring manager as they can. Again, it's nothing personal. This is business. So what I recommend doing is write down what you want. Because it's tough. You don't want to be you don't want to be tripping over your words. Write it down ahead of time. Write down what you'd like. Write down what you'd be okay with. Write down a minimum. And when they ask you, you're gonna say that high amount. It's a haggle, and you don't have to be a jerk about it. And if they lowball you, it's fine to say, I need to think about that. Can I get back to you? They're not going to turn around and offer someone a job the second you leave the office. They've already offered you the job. Once they're talking salary, they've offered you the job. So really, don't answer too quickly if you're not comfortable. If they give you what you want, great. But oftentimes they don't. And it's fine to come back and say, I need to think about that. I have a lot to consider. And you do have a lot to consider. And there's nothing wrong with that. Can I get back to you later today? Can I get back to you tomorrow? It gives you a chance. And it gives you time to even think about, can I do a counter and understand that, all right, maybe somewhere meet in the middle. And sometimes that works. Sometimes they they don't have any wiggle room. And then you might realize that they can't. And then you have to say, all right, oh, it's not as much as I wanted, but I really like the place. Do I want to work there? And you ultimately can make that decision. But don't rush into the negotiation. Write down what you want. Write down your bare minimum. Be patient. Don't reveal too much. Tell them you'll get back to them if the offer isn't what you want. Let them sweat it out a little bit too. Remember, when I'm hiring someone, it's nerve-wracking for me. I need to find someone who fits. I need to often fill a position very quickly. I want to get the best person. And if I think you're the best person, I don't want to lose you over $2 an hour. Yeah, I'll lowball you, but if you come back and I think I'm going to lose you, yeah, all right, I'll give you what you want. So do keep that in mind. All right, so that's all I've got about getting the job. Hopefully this has been helpful, and I'm sure you'll have plenty of questions for when we get together in class. So I look forward to, hopefully I can answer them, and certainly I can even just share some of my experiences as well. Do take a look at the Big Interview website there. I've included the link here. You do need your Sac State login to get in there, but it's useful. They have a whole bunch of resources for interviewing and job searching. So, maybe when you're in your last clinical rotation, take time a few evenings to kind of take a look at that. And then there's some references as well in case you're interested. So thanks for listening and watching. Hope you have a great day, and we'll see you in class.